Hi everybody, welcome to Canine Cancer Alliance webinar. My name is Mary Maida. I'm the director of Canine Cancer Alliance, and I'm also joined by Professor Mark Mamula of Yale University, who is the inventor and who's leading the EGFR HER2 vaccine trial today. We're going to talk about immune-based cancer treatments for dogs. Okay, here's a picture of Susie. Susie was diagnosed with transitional cell carcinoma, and she had bladder cancer. And her parents were very devoted, drove like 20 hours to the leading veterinary university hospital to find out what the best treatment for her would be. And they learned that all they could offer was various versions of chemotherapy, and that her prognosis was quite poor. But they found an integrative veterinary oncologist in Santa Fe, and she was only 4 or 5 hours away. So they started traveling to Santa Fe for her treatment. And Susie lived for over 3 years with bladder cancer, with TCC, and she had immunotherapy with something called Immunocidin, which I'll talk about a little bit later. But Immunocidin was a lot more gentle than conventional chemotherapy, and she had IV infusion, intravesical infusion of Immunocidin, and she had really good quality of life and survived quite a few years. They were all surprised and very grateful that Immunocidin had worked so well. Another pup here, Betty Boop, was diagnosed with hemangiosarcoma and had splenectomy, so had surgery to have spleen removed. It was only stage 1. Mom drove 5 hours from Nashville to one of the Ohio sites that Professor Mamula is working with, and she was able to get EGFR HER2 vaccine. And because of her age and condition, she didn't get chemo, and at that time, clinical trial was enrolling patients even without chemo. And Betty Boop is still here today. I think it's now 2 or 3 years later, with hemangiosarcoma. Ranger's story, many of you may have heard. Ranger had metastatic osteosarcoma that had spread to his lungs. His dad tried so many different things, had him enrolled in a clinical trial at Ohio State University, but eventually found out about Professor Mamula's work with his EGFR HER2 vaccine. And he was told, we can't guarantee anything. We don't know what's going to happen. But Ranger, gradually, over months, his metastatic osteosarcoma started to disappear. And he went on to live 3 more years with original osteosarcoma gone. Unfortunately, he ended up with a different type of cancer and passed away. But these are all stories of hope. It does not mean that immunotherapy can cure every dog. Not there yet, but researchers and veterinarians are working very hard to help more dogs respond to immunotherapy and creating new immunotherapy, especially combining immunotherapy treatments so that the dogs can live longer. Today's talk, we're going to talk about why we need better treatments, types of immune-based therapies, and I think many of you are interested because your pup may have cancer today. You want to know what's available today, not 10 years from now or 20 years from now, but today. What can you do today? And I'll also share some questions that you might ask your oncologist. Let me just say a little bit about our organization. We are a nonprofit organization based outside Seattle. Formerly, we are Canine Cancer Research Alliance. Our primary focus is on research, funding and supporting researchers in clinical trials. And our work is made possible by donations. The reason that we do these webinars is to share what we are learning from our trials, from projects, and from literature, and hopefully opening up doors for families so they can find clinical trials easier, and also understand what evidence and what kind of data is behind some of these therapies. So, why do we need better treatments? Hemangiosarcoma. Hemangiosarcoma is probably one of the most common and extremely aggressive cancers. For golden retrievers who end up with cancer very frequently, actually majority, like 70% of cancer that's been diagnosed is actually hemangiosarcoma. And it's deadly, it happens very silently and suddenly. And when it's found on the spleen, for example, surgery, you do get splenectomy surgery. And though it may not look like it has spread, it is already metastasizing. There is probably microscopic metastasis. So surgery alone, even adding chemo, will only give our pups months to live, not years. So hemangio definitely is a cancer type that we're interested in, Professor Mamula is interested in, and Professor Mamula is starting to make a dent in helping dogs survive even with hemangiosarcoma. Osteosarcoma is another cancer that's extremely aggressive. Surgery is often used to remove primary tumor, which often occurs on the leg. Chemotherapy is given to dogs to delay the spread, but usually it's just a delay, and majority of dogs end up with metastasis to lungs and other locations about a year later. And so how can you prevent metastasis, or perhaps even reverse metastasis, which was possible in Ranger's case, but which is still quite rare. Another cancer type is mast cell tumor. Lilycoy is our dog. It's actually our son's dog. And on June 1st, we were at a park, and he said, look, this little lump started growing really quickly. And this is a lump that was about 2 inches large on her front leg. First, they took her to a family vet, and they did an aspirate and took a small sample of cell, and they said it is cancer. It's mast cell tumor. They don't know the grade, but we should try to see our specialist. And we were able to see a surgeon for pre-surgical consultation. And the grade is not known, but we also did staging to see if it's already spreading, if they could see any nodules in her organs, and they didn't. But we saw a second surgeon who was a little bit more in tune with what's possible with immunotherapy. And so what we decided to do was we actually had an option to have surgery done as soon as possible, which is what we tend to want to do. We want to get surgery done as quickly as possible to get rid of cancer so it doesn't spread. But sometimes it might be better. We don't know for sure, but sometimes it might be better to figure out what's possible with immunotherapy, and possibly, in our case, we delayed surgery to find a surgeon who was working very closely with an oncologist to make a plan so that ultimately we really can reduce the chance of her mast cell tumor coming back. With mast cell tumors, if it's a grade 1, very often it is possible to remove it with really large margins, and you get clean margins, then mast cell tumor may not come back. But grade 2 and 3, very often the cancer will come back. So we wanted to see what might be possible if you could somehow get the immune system stimulated. And even grade 1, there's no guarantee it's not going to come back. So anyway, that's the Lilycoy story, and you'll probably be hearing more about Lilycoy in future talks and things. So why does cancer come back even after successful surgery? It's because tiny metastatic cancer cells might already be hiding and spreading, and traditional treatments like chemo, radiation cannot eliminate all those cancer cells. But immune system could, if done right. Immune system can potentially search out the entire body and looking for those cancer cells. Ultimately, our goal is to help dogs live longer, but preserving quality of life, something that's safe, minimal side effects. And with a therapy that targets cancer more precisely, with fewer side effects, and stop cancer from returning. So that's really ultimately our goal. I'm going to start a story about spontaneous regression. And spontaneous regression is when cancer suddenly just disappears completely. You're cured of cancer. And you hear about this today. But historically, there's been a lot of talk about spontaneous regression, even in Egyptian times. But this gentleman, Dr. William Coley, who's also a Yale graduate, he had noticed some patients, this is back in the 1800s, who had incurable cancer, sarcoma, and cancer disappeared completely. And it was after they had a skin infection called erysipelas, and he tracked down the patient. Several years later, he was alive and doing really well. And he wasn't the only case. There are many documented cases of people with cancer who would get some kind of infectious disease and experience really high fever, get really sick, and then cancer would disappear. And so he had an idea of trying to do this, induce fever. And he and his collaborator, a female scientist, actually, they started experimenting with creating a concoction of multiple bacteria and started giving these to their patients. And they started calling it Coley's toxin. And this is, again, back in late 1800s. And this is a New York Times article saying that germ is a cure for cancer. And this is true. He did actually successfully cure hundreds of patients using his Coley's toxin. And he realized that the key was inducing fever. And it wasn't just one injection. He would go, depending on the response of the tumor, he would inject these bacterial Coley's toxin repeatedly. Some got dozens and some got 50 injections until this fever could be induced. And for about half, maybe 40% of those patients, the tumor started to shrink. And his daughter actually did a really amazing job of documenting and collecting case histories. And it's quite amazing because it's over 100 years ago, and sarcomas are still considered really difficult and incurable cancer today. But he was going about curing cancer patients with sarcoma. But there are risks involved. There were some patients who ended up getting sepsis or getting really bad infection and passing away. So there are definitely risks. Now, at around the same time, there was this competition between what he was doing with another doctor who was really promoting use of radiation therapy. In radiation therapy, Dr. Coley also tried radiation therapy with his patients, and he knew that radiation therapy could shrink tumor very reliably. But the tumors would start growing again. It would just come back. And so that was his argument. Hey, radiation therapy might be good, but cancer just comes back. But then for the other doctors, it was cleaner because most of the patients would respond and they wouldn't have to deal with fever or patients getting sick. And so radiation therapy won out, and his work pretty much got suppressed. Now, in recent times, there were attempts to revive Coley's toxin. There was a startup company in Canada. They spent years creating a new manufacturing plant to create modern Coley's toxin. There is also availability of Coley's toxin in Germany in the 1990s. In Mexico, I think you can still get Coley's toxin. There's a patient that I know who's a scientist, and she had incurable sarcoma in her jaw, and she traveled to Mexico multiple times to get Coley's toxin infusion, and also tried a bunch of other things, and she's still alive, amazingly enough, now about 15 years later. There has been an attempt to revive this, and the interesting thing is that for dogs, if dogs with osteosarcoma, if they experience infection after the surgery, they live significantly longer for those dogs. So there's a couple of papers published about this. But now that we have immune-based drugs, we don't have to rely on an infection from these. And I'm going to talk about Immunocidin, which is basically purified bacterial extract, which is trying to do what Coley's toxin did. But I think one of the criticisms is that there's just not enough data to show how it works or when it works, and there hasn't been a randomized trial. But I'll later go over some of these immunotherapies that are available today. The immune system that we have, humans have, and dogs have, it's programmed to recognize viruses and bacteria and abnormal cells, including cancer. And so immune system is actually fighting cancer constantly. But cancer succeeds and starts growing because it learns how to hide and escape the immune system. And that's one of the things that Professor Mamila has done is the body has to decide whether to attack the cell and say, this is cancer, it's bad, or not attack it because it's just normal. And the real challenge is figuring out how to help the immune system distinguish between cancer cells and normal cells. Because if the drug starts attacking normal cells, then you're going to have autoimmune disease and these awful side effects. With chemo and radiation surgery, you're trying to kill cancer cells directly, but immunotherapy helps your dog's own immune system do that job. And what it is doing is first waking up the immune system and just activating it. And then it has to help the immune system recognize the cancer cells. And then once the immune system recognizes the cancer cells, T cells and other good immune cells will go around the body to find those tumor cells and attack and kill them. And also it will remember. So you don't have to keep on giving them the drug. So that's how immunotherapy works. So waking it up and then helping it recognize is a really important thing. So there are 3 or 4 major types of immune-based therapies. And the first one I'm going to talk about is cancer vaccine. And cancer vaccine teaches immune cells what cancer looks like. So this is different from vaccines that you're familiar with, which is to prevent the disease, like COVID vaccine. This is a therapeutic vaccine. Once you have cancer, you can use vaccine to try to treat cancer. Okay? So basically, it's creating this poster, a wanted poster that says, hey, this is what cancer looks like. It's expressing EGFR or it's expressing these unique proteins, and we want to find them. The examples are EGFR HER2 vaccine, and this therapeutic vaccine targets cancer cells that are overexpressing EGFR and HER2 receptors, and it does that by injecting a small amount of this EGFR and HER2 peptide into the patient. And then the immune system says, oh, usually the immune system tolerates cells that are overexpressing EGFR and HER2 because even healthy cells do that. But now with that vaccine, the immune system wakes up and says, oh, it saw the wanted poster. It's going to go after cells that are overexpressing EGFR and HER2. And it turns out there are quite a few different cancer types that overexpress EGFR and HER2. And when they're overexpressed, then the prognosis is usually really poor because it's like this growth signal. Professor Mamila, right now, his trial is enrolling transitional cell carcinoma patients, osteosarcoma, and hemangiosarcoma, but the vaccine could potentially be effective for mammary tumors and lung cancer and quite a few other ones. Mark, would you like to step in and add a little bit more? I do actually have one slide here summarizing your work.
That's, yeah, very nicely put. Great introduction. I guess what I would only add is that the historically utilized Coley toxin, and there are other similar non-specific ways to activate and rev up immune responses. And there is very good science and medicine to support these strategies. And it's based on really pretty simple ways that the immune system responds. We need really quick acting cells in our immune systems that can respond when we get a very simple infection, whether it's a cut on the surface of your skin or sore throat, etc. And there are these non-specific cells, and they're called things like macrophages or dendritic cells. They see things that they view as dangerous to us and to dogs, and they non-specifically literally eat cells that are infected with either bacteria or viruses. And they're very quick acting, like within a day or two. They don't clear everything, and that's why they don't work efficiently. And then another arm of our immune system is called adaptive immunity, where it takes a little bit of time to program cells to be more specific and to attack specific viral or bacterial proteins or attack specific tumor proteins. So there are quick acting and then I won't say slow acting, but because these specific responses can get activated within about a week or 10 days. So it's not really that slow, but it does take a little bit of time for things like vaccines to work, as we all know. We get vaccinated for flu or anything else, and it takes 2 or 3 weeks to generate an immune response that's specific for flu vaccine. And such is the case for various cancer vaccines as well.
So that's why to enroll in your trial, for example, you really need patients who's got pretty good prognosis that they're going to be around for at least 2, 3 months so that the immune system can kick in and start working. It won't work right away. But so just to summarize here, Professor Mamula, his trial is enrolling patients through, I believe, 11 clinics now. And the latest one that joined is University of Missouri. And most of the other ones, I think, are private clinics, some med-vet clinics in the East Coast and also West Coast as well. And some of the papers that Professor Mamula's team has published shows that it has roughly doubled the survival time, 12-month survival time for dogs with osteosarcoma. And for dogs with osteosarcoma who cannot get surgery, if they are given palliative radiation and the vaccine, then their survival time is also extended, which is really important. And also it helps stage 1 and 2 hemangiosarcoma, splenic hemangiosarcoma patients. Very importantly, it's extremely safe. The side effects are something called sterile abscess. I think everybody wants there to be zero side effects, but sometimes sterile abscess might be a good thing. It just shows that the immune system is responding. And Mark, is it true that dogs who get sterile abscess may have better response to your vaccine, that they might survive longer, or?
I hate to commit to that. Treating cancer, both in humans and in dogs, can get complicated. The tumors change. You may speak to this later, Mary, but both in humans and in dogs, the cancer cells are continue to add new mutations over time. So getting a snapshot or a piece of the tumor today will be very different than what the tumor potentially looks like a month or 2 months from now. It will add mutations. The tumors want to survive. So that is that adds to some of the complexity of what all therapies, both in humans and dogs, have to overcome. And yes, generally, sterile abscess leads to higher or greater immune responses. But for our therapy, and I can't speak to others, in general, most dogs make a very good immune response to our therapy, regardless of whether they get a lump at the site, which is the sterile abscess, or not. And the outcomes of both humans and dogs with cancer are frequently more dependent or very dependent on features of the individual tumor, the specific mutations, for example.
Okay, thank you. Let's see. I'm also going to mention that this vaccine is very simple to manufacture and inexpensive to manufacture, which is huge because there is a trend for developing new therapies that are just really complicated, expensive, and if the therapy costs $40,000, $50,000, which is happening now for dogs, it's just out of reach for too many families. Yeah, simplicity for manufacturing. Even when we're doing research, it just really matters.
I think we all know that, yes, cancer care in humans and in dogs can be very expensive. A goal of our therapy is to be accessible to a larger population of families with dogs with cancer. I think Mary appreciates, as do I, that a particular therapy is only as successful as the numbers, the group of people that can afford and that can have access to a particular therapy. There are many very sophisticated therapies, but I think they are often or frequently just not affordable to most of the population of dog, or a large fraction of the patients with canine cancers.
Thank you. So let's see. So these are some Kaplan-Meier survival curves for stage 1, 2, 3 sarcoma that Professor Momila has shared as a poster in past conferences. So you can see a very distinct difference between dogs who did get his vaccine and others. Oh, and then I'm going to move on to other vaccines as well. I'm just going to go back here. So we talked about EGFR HER2 vaccine, which is part of clinical trial. It's not yet approved. Hopefully it will be approved, conditionally approved, so it can be actually made available through many more veterinarians. There's something called personalized vaccines made out of tumor samples. There's a company called Torigen that offers a kit, so your vet could make a vaccine. And so the tumor is processed so that the proteins are preserved and then injected into the patients. So to educate the immune system. Another company, Ardent, is running a clinical trial with their autologous vaccine combined with an immune checkpoint inhibitor, which I'll talk about a little bit later. There is a therapy called Elias Cancer Immunotherapy, and they have a fully approved therapy that uses autologous vaccine for osteosarcoma. It could probably be used to treat other types of solid tumors as well. It is a multi-step immunotherapy, and it requires surgery to get the tumor removed. And they make a vaccine from that. The dog is giving the vaccination. And then after vaccination, when the T cells are stimulated, they actually removed the white blood cells, T cells, and then you ship it to their lab. They activate and multiply those T cells. They send it back to the clinic. You give that as an infusion into the patient. And then you give them several shots of IL-2, which is a cytokine that stimulates the immune system. So it's a multi-step. It is quite expensive. What was exciting for this therapy was that they discovered that instead of giving this immunotherapy on its own without any chemotherapy, so just surgery and immunotherapy, they realized that if you add one chemotherapy session, it could boost up the response rate. So that was their latest discovery. But anyway, it is available and fully approved. And so if your dog has osteosarcoma or solid tumor, that is something that is available through Oncologist. Let me see. Now, so we talked about vaccines, other immune stimulants. We talked about a little bit about Immunocidin. So this is a bacterial extract. And do I have a slide here? Yeah, it comes in a little bottle like this. So it's purified bacterial cell wall fragments, and it also includes bacterial DNA, which, as Mark said, there are things that stimulate the immune system immediately. The innate immune system gets stimulated. And Immunocidin contains various molecules associated with bacteria. The good thing is it's fully approved by USDA. It's been around for a long time. It was approved for mammary tumor, so many vets think that it's really only good for mammary tumor, but it has been given to dogs with bladder cancer, osteosarcoma, hemangiosarcoma, and off-label use is possible. And it could be administered intratumorally, so injected right into the tumor, or as an IV infusion, and also oral dosing. For example, for mast cell tumor or osteosarcoma, their protocol combines oral dosing and IV infusion. Intratumoral sometimes they use. And then from what I hear, it is quite safe, and sometimes it can help pups survive longer than with conventional therapies alone. So Immunocidin is available, so it can be ordered by any vet, not just by oncologists, but regular family veterinarians. There's a cytokine, very potent cytokine called IL-12, and there are clinical trials now evaluating IL-12, intratumoral injection of IL-12 for dogs with melanoma, and that's probably going to go through regulatory approval process and become available. I don't know when. There's toll-like receptor, TLR agonists, that stimulates the innate immune response also. We are hopefully launching a new study looking at something that stimulates that TLR, and perhaps that alone or combined with Professor Mamula's vaccine or other vaccines, it may really boost the immune response to help more dogs. These don't necessarily identify the cancer. It's not saying, okay, this is a protein, but they do really activate the immune response. Let's see. Now, but cancer is extremely tricky. They have ways to protect themselves. When the immune system gets activated, immune cells like T cells have on its surface receptors that helps it get turned off, because you need a mechanism to turn down and reduce the immune response. So those receptors are there, and cancer takes advantage of those receptors to turn off the T cell response, for example. And those are called checkpoint receptors. So cancer can turn off T cell response, and it can also even bring in cells that protects cancer and create a really comfortable immunosuppressive environment, a neighborhood around itself. So things like neutrophils and regulatory T cells and MDSCs, these are immune cells, but they're actually suppressive immune cells. And so they're helping cancer. So cancer is actively doing that. Recently, there's a huge excitement because we now have a canine version of something called PD-1 immune checkpoint inhibitor. And so it basically takes the foot off the brakes and helps the immune system become active again after cancer has suppressed it. Merck has introduced and has a conditional approval for a drug called Gilvetmab, which is a PD-1 immune checkpoint inhibitor. And this drug can be ordered by an oncologist, not family vet, but oncologist, and given as an IV infusion to help dogs with cancer. The data that they have published is sparse. It's just the number of dogs is very few, and the effect that they saw was not dramatic. But many of us believe that if Gilvetmab or PD-1 checkpoint inhibitor is combined with other immune stimulatory drugs, then it's probably going to work better. It is known that it works better for tumors with very high mutational burden, lots of mutations. It tends to work better. So this is a drug, Gilvetmab, that is available to be ordered by oncologists. That's something that if you're looking for another option to boost immune response, it's something to consider. By the way, it's also quite expensive. I'm also going to mention something called in situ vaccination. Now, if you kill the tumor locally, then it's possible to kill the cancer cells in a way that it releases the tumor antigens, tumor proteins, and then it activates the immune system, and then start attacking cancer, even in other locations. And it's called in situ or in situ, depending, in situ vaccination. So it's really turning a tumor into its own vaccine. So instead of surgically removing the tumor and then injecting the tumor vaccine into the patient, it's just manipulating the tumor locally and then killing it in a way that releases the proteins without proteins getting damaged. So you could sometimes do that with radiation, especially palliative radiation, or something called electrochemotherapy. You use short pulses, and that opens up the walls of cancer cells so that tiny bit of chemo that you inject can rush into those cancer cells, but the dose of chemo that the cancer cells are going to get is extremely high. And then it ends up killing the cancer cells, but the cancer proteins are preserved. And so it ends up activating the immune system. And we had a really excellent webinar on this topic with Dr. Chelsea Tripp. And electrochemotherapy is starting to become available in the US. It's been available in Europe for decades for both people and for dogs. But unfortunately, it just did not catch on in the US. There are 3 companies offering electroporation equipment that vets here can buy. And so if you go to any city, there should be 2 or 3 or 4 oncologists with that equipment who can do electrochemotherapy. And unfortunately, if you go to a veterinarian who does not offer it, they might not know anything about it. So it's really important to learn about electrochemotherapy, I think, because it's quite a good option because it might be able to induce in situ vaccination, and also it's quite affordable. Another way to induce this effect is using cryotherapy or pulse electric field ablation, which is irreversible electroporation. Basically, with this electrochemo, you treat locally a tumor, but you end up creating an abscopal effect. So the other tumors, the rest of the body, will also respond because the T cells end up getting stimulated. Really, the future is combination therapy. So a single immunotherapy treatment is probably not enough for most aggressive cancers. You need to combine multiple immune modulating therapies, and you want to attack it from multiple different directions. So something that stimulates the innate immune response as well as vaccines. And also I want to mention targeted therapy. Targeted therapy is really not immunotherapy, but it could be synergistic. There are companies that are now offering mutational or genomic profiling of tumor samples. You send them tumor samples and they'll come back with analysis saying, oh, this tumor might respond to these targeted therapy drugs. And these are oral drugs that could be ordered by your oncologist. And in particular, there is a company called Vetomics that offers a newer genomic profiling service. The other ones are older and they don't do a full comprehensive profiling. And the test will suggest different oral drugs that could be used to weaken the cancer cells. And so even though it might not directly be stimulating the immune system, these targeted therapy drugs may be synergistic with immunotherapy drugs. Some of the things we talked about today, we have surgery, chemo, and radiation. Surgery, if the tumor is local, it's great. Chemo, it helps some cancers. Radiation also helps some cancers. But if you use radiation therapy, especially palliative radiation, it could induce this in situ vaccination effect. And there is growing evidence now and more trials, especially in humans, on the human side, of combining low-dose radiation, not aggressive radiation. Aggressive radiation tends to suppress the immune response, but low-dose radiation with immune checkpoint inhibitors or vaccines. So that's really exciting to see. Also, today we have a number of different cancer vaccines, including EGFR HER2, cancer vaccine made from the dog's tumor, Elias immunotherapy. Some of them are in clinical trials. Some of them are commercially available because they're fully approved by the USDA. And there is growing data being collected on the efficacy and safety of these therapies. Immunocidin is fully approved, but for most cancer, because it was approved for mammary tumor, it's going to be used off-label. And originally it was approved for intratumoral use, but it could be used as an IV infusion or orally. And it remains to be seen. I hope we can get more data on the efficacy and safety of immunocidin as we go on, but it is available to be ordered. Electrochemotherapy, even though it's not called immunotherapy, it does have immune modulating effect as well as killing tumors, and it also constricts the blood vessels around cancer cells. So that's another third effect. But electrochemotherapy is starting to become available. But here in Seattle area, I know 3 hospitals that offers electrochemotherapy, and most of the vets are not offering it. So if you're interested in it, do a Google search and look for a hospital that offers it. And there's really growing evidence that how potent and how effective electrochemotherapy is with cancer that's hard to treat, and it could have a systemic response. And that's what Lilycoy, our dog Lilycoy with mast cell tumor, is going to be getting. We were able to find a surgeon who's teamed up with an oncologist who's going to do a surgery, not to try to remove as much of the tumor as possible, do aggressive surgery, but just basically debulk and just rely on electrochemotherapy to do the cleanup. So it's very different from the first surgeon that we talked to, who wanted to do a very aggressive surgery, which may have ended up having really long time for the wound to heal. The surgery that Lilycoy is going to get is going to be hopefully a very quick recovery time, so she can do electrochemotherapy. And her oncologist is going to give her electrochemo, even if it's grade 1, just to decrease the chance of the mast cell tumor coming back. I think a lot of surgeons and doctors might say, if it's grade 1, it's okay, don't worry. But we just want to really reduce the chance of it coming back. So we were really happy when we heard that. Even if we find out it's grade 1, they're going to do electrochemotherapy. And it's quite affordable. It's $1,200 or something like that. Anyway, so radiation therapy costs $8,000, $10,000. It's quite expensive now. But anyway, so I can't say, I think electrochemotherapy has a lot of promise. Targeted therapy here is listed just because it may be synergistic with other immune modulating drugs. And there are a number of companies that can do genomic profiling. Atomics is a newer test that can do a more comprehensive profiling, and it may work well with some treatment. So it's an important question to ask your oncologist. Bring up immunotherapy, because traditionally oncologists have been trained on chemotherapy. They really understand how chemotherapy works, what combination chemotherapy works, and side effects. And they're starting to pick up on immunotherapy. So bring up immunotherapy and ask them, would immunotherapy be appropriate for my dog? Are there clinical trials? Would genomic testing help? Should treatments be combined? That's another question. And ask them about radiation or electrochemo. But I think you might want to do your homework, if you are interested in electrochemo, on finding a doctor, a local doctor that is offering electrochemo, if you're interested in that. So things to remember: immune system can fight cancer, sometimes even metastatic cancer. Combination therapies are going to become more and more important. Some immune treatments are already available outside clinical trials. Clinical trials are extremely important in making any change in the future. And your participation in trials or being part of our community is really important to change the future. Let's see. And all these events are possible because of families, researchers, and scientists like Professor Mamila, veterinary oncologists, clinical trials, donors, and nonprofit organizations. And we want to help the next dog, but also dogs today. Thank you so much for listening. And we are going to switch to questions. Let's see. Somebody who's asking about, is there that correlate with remission, or say that it's working? Is there a biomarker? Does the antibodies, or are there any biomarkers that can tell you that the vaccine is actually working or not?
Yes, we test that in our laboratory. For all of those that participate in our clinical trial, we get blood samples from all of our patients, and yes, we can tell that. Is it relevant for you to know the results? Well, not really, honestly. We know, for example, and this is both in human cancers and in our clinical trials, that dogs, everyone responds slightly different to immunotherapy, vaccines in particular. Humans that get the same vaccine, whether it's flu or COVID or mumps, measles, rubella, will have various levels of immune responses. But nonetheless, most humans that get a measles vaccine, for example, are all protected from getting infection. We know that Some dogs, even with lesser responses, can have very good outcomes in our study. We also know that some dogs with very high immune responses to our therapy may not do that well. And again, that's because, as we were discussing earlier, some tumors with lots of mutations may be more difficult to find therapies for. There's a question here about DNA analysis, and in particular, do dogs without EGFR HER2 oncogene benefit? That is also an interesting question. There are two ways to think about this. Dogs and humans have EGFR proteins on their tumors. They may be there in different amounts, which is important, or they may be there with mutations. Many of the genomics companies measure just the mutations, an abnormal form of EGFR or HER2, but not necessarily the native or the normal form of EGFR. Those are two different proteins again. This happens in everyone. Mutations are a way that the tumor can avoid various therapies. So the technologies don't allow these things to be very accurately identified, particularly the non-genomic laboratory tests, immunohistochemistry as it's called. We know that humans with very low levels of EGFR and HER2 can respond very well to therapy, so you probably don't need much of these proteins on the surface of tumors for therapies like ours or other small molecule inhibitors, other therapies to actually work quite well. Hope I'm not confusing people, but it can be dense to understand what you get back from clinical laboratories.
Yeah. So I think sometimes Vatomics test might say, hey, here's a mutation, your vaccine might work for your dog, but there hasn't been data anyway collected yet.
That's correct.
And even if there's no mutation, could it work because cancer is always mutating and it may start overexpressing those proteins?
Yes, actually. So drugs that are used in humans, immune drugs, Herceptin, Erbitux, as well as our EGFR therapy, probably bind both the normal EGFR and HER2 proteins as well as some mutations in those proteins. It depends, and there's more work that needs to be done there.
Okay. Okay. Good. And Rick Neisel and Nancy are here. Rick is Ranger's dad, and Nancy is Betty Boop's mom. Hi, Nancy. Hi, Rick.
Hi, Mark.
There's a question about radiation here, both palliative and stereotactic. Those are two different types of radiation. I'll defer to your radiation oncologist to answer those questions. A lot of how we think about treating our dogs is based on what's available. Mary mentioned electrotherapy, radiation therapy, our therapy. All of these are not immediately available to everyone locally. So you really have to do some searching and some understanding of what therapies are available to you.
Yeah. Mm, yeah. Here in Seattle, radiation therapy is not available. You have to travel to Oregon or to Eastern Washington, drive 6 hours to get radiation therapy. But luckily for us, electrochemo is available. I think a lot of people are relying on that. I want to add another answer to the question about wondering how do we know the vaccine is working? Well, how do we know any treatment is working? And there is a liquid biopsy test from a company called CanCan Diagnostics. CanCan Diagnostics is created by a company in Edinburgh, Scotland, and they do cell-free DNA. They take blood sample and they look for those tumor markers in these mutated DNA. And their test is extremely sensitive. For some cancer types, like hemangiosarcoma, they say that they can tell if there's residual disease, and after surgery, the cell-free DNA number will dip. But then as you come out of remission, that number will go up. So it's possible if you contact them and ask about your dog's cancer type for disease monitoring. And I think last time I checked, I think I tried to do that test for our dog Momo, and it was about $500. And they might have a lab in the US, but look up CanCan Diagnostics. And we did a webinar last fall with the founder of CanCan. Okay, lymphoma and liquid cancers, EGFR HER2 vaccine won't help. Is that right?
That's correct. Those don't express EGFR or HER2, either the normal or the mutated forms. They just don't make it.
Okay.
But there are other good therapies for those cancers. There are other therapies, whether
I wouldn't say they're good.
yeah, I caught
There's no
myself
good
there.
immunotherapy for lymphoma or leukemia, I don't think. For people there is, but not for dogs yet.
That's correct.
Yeah. Can immunotherapy be used as preventive medicine? Mark?
Great question. We are not yet utilized as a healthy dog immunotherapy. It's an intriguing and interesting question that we hope to know the answer to in the coming years. We do know that dogs that are in our therapy, we recommend yearly boosts, single injections, to maintain a stronger anti-tumor immune response. Whether that will actually work ongoing in healthy dogs, we don't have any evidence to indicate whether that is true or not.
But I think as a preventative, I feel like with golden retrievers, for example, they might just have small cancer starting to grow very at around 7 or 8. And if you give them immunotherapy, it'll just get cancer at stage 0.5 or something before stage 1, where you have much better chance of killing it. But I wish we could run a clinical trial, a prevention clinical trial.
You bring up a good point. Dogs that are older are more prone to cancer. There are breeds that are more prone to various cancers. You bring up golden retrievers and hemangiosarcomas or osteosarcomas. So yes, would or should, I won't address that, but as dogs age, it may be more reasonable and thoughtful to proactively treat dogs with immune-based therapies in advance of their tumors.
Okay. What can we do to catch hemangiosarcoma at stage 1 or 2? Regular scans. So we had a webinar with the founder of Calvary earlier this year. They have a new test called Calvary Stage 1 Plus, which is a blood test that looks for markers stage 1 cancer. And they actually did a really good job of collecting samples of dogs who actually had stage 1 cancer. And so their test, I think, is available or is starting to become available. I had asked our vet to try to get this test ordered, and she couldn't get a response from them. I think they are rolling it out slowly. I'm going to contact them to see what it takes to get the test sooner than later. But there are a number of tests that are being marketed to families directly on social media, and they are really based on tests, evaluation based on very few number of dogs. And also, they don't even test stage 1. They take samples from stage 2, 3 dogs. So I think Calvary, I'm hoping, is looking more promising because of the data that they collected, but really needs to be seen. Okay. Anybody want to just and ask a question? We're processing here.
I'd go ahead and ask a question. Thank you guys both for the information and also for using your expertise to come up with the first hope for HSA cancers. Had a question about, I'm in the Midwest, and most of the med vet clinics aren't enrolling right now, except for Pennsylvania, where they say you have to be a resident of the state to enroll. Are there ever any programs, awesome when this is approved, hopefully by USDA in 2027, but that'll be too late for our dog. Are there ever any compassionate use where you could get the vaccine outside of clinical trial?
I would suggest you contact, that's a bit of a complicated answer. Sometimes yes, but the USDA is reluctant to allow these things. They prefer patients get our therapy at a clinical trial site. In part, it causes them lots of time to process these things for one dog as opposed to a clinical trial site that may be able to. I understand that. I am sensitive to the fact that a lot of the clinics have become overwhelmed with requests for getting into our trial. And I feel bad that that they can't accommodate everyone that has need for it. Some of the clinics have gone to prioritizing local patients or patients that they can follow up in their own clinics, which kind of makes sense, right? Unfortunately, a lot of patients just will travel however number of hours it takes to get to a trial site just to get our therapy and then never show up again at that trial site for follow-up, for example. So I can understand an individual clinic's need or prioritizing certain patient populations that they can follow carefully.
Does your dog have hemangio?
Yes.
Yeah. Yeah.
Could I ask a question, please?
Go ahead.
Okay. Our dog was recently given the NUQ test and came back at very high risk. She's part of a service dog organization, and there are several dogs that have had some issues with this, golden lab mixes. She has had scans, x-rays, etc., and it looks like all of her organs are clean. I'm wondering, does that mean she's stage 1? Because I'd love the definition of what that is. And is there a place for her in this particular trial as a dog at the very early stage?
I'm sorry, this is hemangiosarcoma?
Yes.
Yeah, I don't pre-qualify or enroll. That's against the rules of the USDA, but so just contact a trial site directly. Where are you located?
We're outside of the New York City area, so it would be the Stamford location.
Yeah, yeah. Yes, Stanford is actively enrolling, and Dr. Thalheim, Lindsay Thalheim there is terrific. Contact their office. They will ask for records and take it from there. Give you all the details.
Yeah. And is
Did
that
you-
considered stage 1?
did-
Because I'm not sure what the stages are.
Wait, did you say
Uh,
the imaging came back with her
Yes.
clean, completely clean, or did they find any tumor?
They found no tumor. We
Okay,
tested
that's
her at
problematic.
we tested her at age 5.5 because some of her relations had this issue, and it was recommended we start screening right away. And our vet said, why don't you start with the NUQ test? And that came back high risk. So we did all the scans, and those so far are clean.
oh, but your dog has not had splenectomy, is that correct?
No,
Has had no surgery?
no,
They don't see
And
anything. They don't see anything. Just the UQ test
no.
said.
But Volition did suggest we both rerun the test, the NUQ test, and if it remains high, to get a full CAT scan.
Yeah.
I will leave that to Dr. Thalheim to address. In general, we need a confirmed diagnosis of a particular tumor type, whether it's osteosarcoma or
Okay.
hemangiosarcoma, not a dog that is, quote, at risk, but with no evidence of disease. But I understand why you would want to treat, of course.
Yep. All right. Thanks for the clarification.
So I might suggest a few things. Again, this is not a veterinary advice at all, But I mentioned CanCan Diagnostics test. So they might be able to also independently see if they can see hemangiosarcoma-related mutations. So you can, doing another test, this is good probably, but trying CanCan might also be good. And also, if you are looking for immunotherapy, there's no tumor to make vaccine from, or there's no tumor present that you can see, you might not qualify for the EGFR HER2 vaccine. In
Right.
which case, Immunocidin might be something you might want to look into. It's really tricky to use Immunocidin because you have to find a vet comfortable with using it, and not too many vets are experienced with it. But IV infusion of Immunocidin is a very strong immune stimulator. And if it's still very early stage, it might start killing early hemangiosarcoma cells. And then you can retest a few months later to see if the test comes back negative. But again, this might be completely false positive for you, that the volition test is not, it might be wrong. I've done that too. I thought my dog had cancer and went and had tested. One of the tests came back positive, so I did a lot of imaging, and they all came back negative, hoping it's false positive. But if you want to try some form of immunotherapy, IV infusion of immunocidin is probably the only one that's available.
Okay, thank you.
Mike, could I ask a question?
Go ahead.
Of course.
Okay, thank you. My dog has adenocarcinoma metastatic, and he's getting carboplatin for chemo and a COX-2 inhibitor at a university vet hospital here. We live in Germany. He's in the evaluation pipeline at BARC. Mab is not allowed in Germany, but we're exploring treatment for him in Switzerland too. Should we try to get him on Gilvetmab via Switzerland while waiting to hear if we can get into the US vaccine study via BARC or another way?
Are you waiting for me to take that, Mary?
Go ahead.
The short answer is there's no data to support the use of Gilvetmab, only because it just doesn't exist in adenocarcinoma. In theory, and this is comparing what we know about treating human cancers with this type of drug, is that in theory it could potentially help.
Okay. All right. Thank you. And a
But
follow-up.
there's just not data to answer your
Okay.
question.
Thank you so much. I was paying attention to what you said about multiple therapies at once. One other question. Do dogs continue to get chemo and COX inhibitors and other drugs after they have the vaccine? It seems like chemo and the COX inhibitors are not so good for their system.
Without having specific information about a specific dog and its specific tumor, it's a bit impossible to it's difficult to generalize here, except to say that appropriate care will be managed best by vet oncologists, which typically includes a full course of chemotherapies. And as you ask, combination therapies, meaning chemotherapies alongside of other therapies, both in humans and likely in dogs by emerging data, will likely be the best options, if that makes sense.
Yes, it does. Thank you both for the very important and wonderful work you're doing.
Yeah, good luck to you.